Assalamu alaikum and a very pleasant good evening to all our viewers and listeners. Welcome to Doctor in the House, where we continue to educate, raise awareness, and advocate for women's health issues in order for you to make more appropriate health decisions and seek better health care. I am Dr. Amina Khan, specialist obstetrician and gynecologist, and have been practicing medicine for over 25 years. I'm also a council member for the Trinidad and Tobago Medical Association Central Branch, where we teach, treat, mentor, and advocate. Tonight we have a very important and pertinent topic, and it is entitled, Let's Talk Fertility, the Basics. Because this topic is very broad, I will be very excited to have my guests come back for future episodes, inshallah. So my very special guest tonight is none other than Dr. Catherine Minto Bain. She is a fertility specialist, consultant obstetrician and gynecologist, and the medical director of the Trinidad and Tobago IVF and Fertility Center. A fertility specialist for more than 25 years, Dr. Catherine is a Bristol University Medical School graduate in 1993. She moved to Trinidad and Tobago following her early career at King's College Hospital and University College in London, and has led the TTIVF and Fertility Center since 2008, bringing more than 3,500 healthy babies into the world through IVF, IUI, and other fertility interventions. Under her leadership, the center is the only fertility clinic in the region to achieve rigorous European International accreditation with TIMOS. Her specialty fertility training started with her clinical research post in reproductive medicine in the University College in London. From 2005 to 2018, she lectured in obstetrics and gynecology at the University of the West Indies. Her research is published internationally in medical journals and textbooks. TTIVF new state-of-the-art fertility center has recently opened its brand new clinic at Icon Plaza in Aranjuez. You can reach them at 615-BABY, that's 615-2229 or 235-2392. And we can look at this beautiful infographic here that's highlighting what I've just reiterated. So just a little history. Trinidad IVF has been providing superb fertility services to TNT for more than 25 years. They have helped more than 18,000 people and have brought more than 3,500 babies into the world. They are well known in the Caribbean as leaders for safe and successful fertility treatments. The first IVF baby in the English-speaking Caribbean was born in 1997, right here in Trinidad. I will not say how old I was at that time. So, welcome, Dr. Catherine. Let me start by giving a little synopsis. So, infertility affects millions worldwide, and yet it is still one of the most misunderstood and stigmatized health conditions. Tonight, we're breaking the silence. Infertility is a medical condition. It's not a personal failure. Infertility affects women and men almost equally, and it is a couple's issue. Therefore, couples need to be investigated. So with that, I'd like to welcome you, and I gave a very brief summary of your credentials. I'm very happy to have you here tonight. So what is the definition of infertility?
Dr. Amina, I'm absolutely thrilled to be here, and absolutely what you're saying about people struggling with fertility problems. It's a huge problem, and it's very much not talked about. So I'm delighted that we're here talking about both female and male fertility struggles. So infertility, the definition has changed recently. You and I would have been taught at medical school that infertility is when you don't get a pregnancy within a certain time frame, and generally we were taught that that was 1 year. So it's the inability to conceive or get a baby within 1 year of trying. But more recently, the definition's changed, and infertility is now said to be a couple who need medical help to get a baby.
Wow.
And that helps include people that maybe have social types of infertility. So there are couples that maybe can't get a pregnancy for other reasons. It includes single women who maybe would like to use donor sperm to have a baby. So it encompasses, it's to open up the definition to more people. But essentially, if you're not getting pregnant and you've been trying for a year, most couples will have conceived at that point, and that's what infertility is.
Right, very good. So having said that, does Trinidad and Tobago have a bigger infertility problem than elsewhere in the world?
I think you and I both think it does. We both work in the field. We see the female, you'll see the female side of it in OBGYN, and there's so many people coming through your doors, I'm sure. I've been working here in Trinidad and Tobago since I emigrated here in 2004.
Right.
And it struck me when I came here that I was seeing a lot more men with fertility problems than I had thought. And they had more severe problems than I would have ever seen coming through a clinic in London. And my gut feel when I first arrived was, wow, I think there's more of a problem here. And since then, we've done some research here in TNT through TTIVF. And if you look at the international research, our gut feel is correct, yes. So men in developing countries, and definitely in the Caribbean, our research shows, have more male factor infertility, and it tends to be more severe. And if you look at the research worldwide, women of color, be that Afro-Caribbean, East Indian, or Hispanic, women of color have more infertility, not less. This idea that we have less infertility in our population of women is wrong. We have more infertility, more pregnancy losses, more losing eggs early, premature ovarian failure in women of color. So we're sitting here with a population that's definitely got more problems. And if we look at WHO, the World Health Organization says that around the world, globally, 1 in 6 couples are going to struggle to have infertility, and we're saying that's commoner here. You can see there are thousands and thousands of people struggling right now to get that baby that they really want or to add on to their family.
Right. And I mean, that's so important because we need to emphasize to couples that the earlier treatment is sought, then the higher chance of success. And that's what a lot of people don't recognize or realize. And you know, nowadays, a lot of people are putting their fertility ambitions on the back burner because they tend to focus, they tend to focus on careers, you know, getting their house, you know, building, being secure in other ways, you know. But we have to emphasize the couples that, you know, sometimes it's not a matter of just starting one day and just automatically thinking that you may achieve a pregnancy that easily. I mean, we would love to, but you know, we also have to bring that awareness, you know, and I think that's where our conversations come in. So how does someone know that they may have fertility or infertility, and when should someone start to see a fertility specialist?
Let's answer the second part first. You should be seeing a fertility specialist, and that's someone who specializes in both men and women having fertility problems. Once you've been trying for 1 year and you're under the age of 35, both of you. So 1 year trying, you should be seeing a fertility specialist if no pregnancy has come along or no live birth. If you're older, you don't have as much time. So people, men and women 35 and older, the time frame is shorter. 6 months, no pregnancy, and you should be being seen in the fertility clinic to get tests. And how would people know they have infertility? Well, there are some people who shouldn't wait. If you know that you had fertility with a previous partner, you come straight in and get reassessed. And then there are some warning signs for men. Some men are very overweight, have a lot of illnesses. They are worried they might have erectile dysfunction maybe. There are a variety of things that a man might be dealing with that mean you're going to have trouble with fertility. So come through straight away. Some guys are just worried. They look at their semen when they ejaculate and they think it looks wrong or it's too small amount, and they're just instinctively worried. You just come through and do a sperm test. It's easily checked. And then for women, there are some easy things as well. If you're not having periods, you come through straight away. If you have very painful periods, a lot of women don't realize that period pain is not normal. And if you have period pain, come through quicker. And irregular periods, a lot of spotting and bleeding in between your periods. Anything that doesn't seem right in your cycle, see your OBGYN or come to the clinic quicker.
Yes, and that's very important because, like you said, a lot of couples may see those silent signs, but they may ignore them because they may just say, well, it's something that may go away, or they will not think that it is important enough. And also, we do know that based on the Caribbean culture, based on local culture, you know, men sometimes feel, couples in general may feel embarrassed, and we want to change that narrative as well. We want to encourage them that no, all these clinics are confidential, and there's nothing to feel embarrassed or ashamed about, because this is helping you to be able to achieve something that's so important in your life. And we don't want to miss that window of opportunity, you know. So everything that you said is so important. So we would try to outline separately what can cause female versus male infertility. So what are some of the causes of female infertility?
So when you're thinking, why might a woman not be able to get pregnant? A woman's side of things is probably going to cause about half of infertility, and about half is caused by the guy. And then we should say that over half of the couples we see at TT-IVF, they have more than one thing going on. So that's a really important point for people. If there's one thing that's been seen, like a woman's been told you have PCOS, it doesn't mean he hasn't got sperm issues. So be very careful. Half of the couples that we see who are told it's just PCOS, for example, or just something like the tubes, it turns out the guy has got a real sperm problem. So half of couples have two or more things. So coming back to the woman, you're thinking, okay, you're thinking her eggs, you're thinking her tubes, and you're thinking her womb. You need those three things all working nicely for a pregnancy to occur. So eggs might not be growing and coming out properly. Commonly it's polycystic ovaries, but it could be another hormonal issue, or it could be that you're actually heading into an early menopause and you haven't got much time left, premature ovarian failure. So eggs growing and not coming out properly. And now we also know there are genetic conditions that for some reason we're seeing more commonly, meaning the eggs don't grow properly, they can't mature properly, and that's a condition called eczema. And I think a lot of doctors don't know about that one. That's new in the last 5 years.
Can you repeat that again?
Eczema.
Oh, right, okay.
O-Z-E-M-A, and it's a there's a range of genetic problems that mean the eggs or the embryos don't grow properly.
Right.
So eggs coming out can be an issue.
Right.
And then the eggs and sperm getting together can be the second issue. So if a woman's tubes are blocked, or if the woman's tubes are open, but something outside of the tubes is causing scar tissue, so those tubes can't actually suck up the egg, or where they can get to the ovary, but there's a curtain of scar tissue around the ovary. So the tubes can be open and not working, or blocked, and the egg doesn't get to the sperm. And then egg quality. Your eggs might not be able to make a baby. And that's very common as you get into your late 30s, and in your 40s that's biologically normal.
Right.
But it can happen to younger women. Younger women can have egg quality issues that they wouldn't know about. We don't have a test for that one.
For egg quality.
Yep,
But
no test for egg quality.
Right, but we can assess egg quantity.
Yes.
And we can try to discuss that very shortly. We're going to take a very short break for the call to prayer, or the adhan, and we will return to continue our elaborate discussion. Welcome back to Doctor in the House with my very special guest, Dr. Catherine Minto-Bain. When we went on a break, we had started discussing female infertility causes, and we summarized that there are three different factors. We need to look at eggs, we need to look at the fallopian tubes, and the uterus, or the womb as well. So just resuming, we can continue where we left off.
So the third part, just like you were saying, the third building block that's essential to be able to get a baby is the uterus or the womb. So when you're thinking about the womb, it's the lining of the womb that needs to be really healthy. And people think, okay, well, maybe fibroids, which are balls of muscular tissue in the muscle of the womb, people think that that causes infertility when the vast majority actually don't. But anything near that lining, that inside part of the womb or inside there, just can stop an embryo implanting or cause a problem in early pregnancy. So we're looking for polyps inside the womb, fibroids that are inside the lining of the womb. Those are the ones that can cause fertility issues. We're looking for scar tissue inside the womb, and then we're looking for chronic infections in that lining as well that can stop an embryo implanting. And that's the infertility that women are facing. That's what causes fertility problems in women generally.
Yes. And the conditions that could contribute to that are the three main ones, I believe. So polycystic ovary syndrome, pelvic inflammatory disease, which is a pelvic infection that, a lot of times is silent. So patients are not aware that they may have been infected, and that can cause consequences. So it's even their, early assessment to the general gynecologist like myself, before I refer on to you. So, and then thirdly, a very important condition I would like to emphasize is endometriosis. So what you spoke about with regard to the scarring that's outside the uterus, that because of that chronic inflammatory condition, it's contributing a lot. So, that's why it's so important for us not to miss those conditions and refer on, couples who need assessment.
I think that's so important, and actually you're quite right. There's a few things I think that are really good for couples, women to know. So number one, PCOS. If you have PCOS, it's relatively easy to get you pregnant with fertility tablets, but if you're not having regular periods, please see your OBGYN and keep your body healthy. You need to be having periods regularly. It's really important, and if the lining has got abnormal, you're not going to get pregnant. Very importantly, endometriosis we were talking about. It's a hugely common condition, 1 in 10 women. And if you have very painful periods, or if you have painful marital relations, if passing urine is very painful, all of these things are signs of endometriosis. And endometriosis doesn't just block your tubes, it can affect your egg quality. So women really, if you have endometriosis or you have very painful periods, or if it's in your family, your mother or your sister have it, you're more likely to have it, it's genetic. You really should be getting an egg level to see how low your egg level is for fertility assessments, and get that early. We're getting women coming through now at 25. My sister has bad endometriosis. She's struggled with IVF with you at 33. I'm 25. Should I be getting checked? Yes. A pelvic ultrasound, let's get you prepared. If your egg level's very low, you might want to freeze eggs. But also you want to be seeing an OBGYN to prevent the pain that you don't need to be suffering with. So a lot of things that you can do to help yourself. PCOS, endometriosis. Mm-hmm. What was the third one?
And then, as we said, pelvic inflammatory disease, right? Because that's very common, and a lot of people are not aware that it is a sexually transmitted infection, right? Most commonly chlamydia and gonorrhea. So these things, we have tests that we can confirm, clinical examination, doing the tests, getting patients diagnosed so that we can treat them before it progresses to cause damage to the fallopian tubes.
Absolutely. Getting treated and seeing your doctor prevents damage in the future that will damage your fertility in your tubes, yes.
Of course. So we were talking about the woman, and of course we have the male partner. And as we said earlier on in the program, fertility issues can arise from both the males and the females. So we have a couple. How would the man know that he may have infertility? What are some of the things that they should be looking out for?
So guys, a lot of the times you're not going to know you have a sperm problem. It doesn't show up with many symptoms for most people. And we think about 1 in 15 guys have a problem with the sperm. And a problem with the sperm isn't always low numbers. You can have 3 things. You can have, yes, you can have low numbers, but you can have perfectly good numbers and problems with the swimming. You can have problems with the shapes, and guys, if you have low numbers of normal shaped sperm, you do take longer to get pregnant. That's a fertility problem. And then the sperm test can look lovely, but 1 in 10 guys will have a quality problem inside the sperm. So basically, sperm can get to the egg. You've got good numbers, good swimming. It can get through all the women's defenses, but when it gets to the egg or it gets inside it, it's not going to be able to make a baby. So there's lots of things a guy's sperm could have a problem with. And sometimes you might know, you may have had a problem with a partner before. You may be very unwell with diabetes, high blood pressure, cardiac disease. All of those things make it more likely your sperm is going to have problems too. Because the sperm is actually like the canary in the coal mine. It's one of the first things that shows up other problems in the body. If you're generally unhealthy, your sperm tends to show it up first, interestingly. Mm-hmm. Maybe in 10, 20 years, all boys going through puberty will do a sperm test to check their general health. I don't know.
Yes.
So guys, and then erectile dysfunction, we shouldn't forget that some guys are having problems not with production, not with making the sperm in the testicle, but with getting it out. So some guys are having real problems with erectile dysfunction or sexual function, and again, come through and see us because there are treatments and help with that for fertility.
Right. So lifestyle as well does contribute, right? So meaning even consumption of alcohol, smoking, all these lifestyle, obesity. So taking care of your general health is also important. We have to emphasize that because these basic things can affect. We hear a lot of talk about stress causing infertility. Now, stress is not the main factor because we all have to deal with stress on a daily basis, but it can contribute. But, we can't just put it down to stress and assume it'll be resolved naturally, Is there really something called a global sperm crisis, known as Spermageddon? What is that?
So there is, and if you talk to the sperm experts around the world, and we had one of them down here in Trinidad, we brought him down at the end of last year, there absolutely is what they call Spermageddon. Scientists are getting really worried. Dr. Chris Barrett, one of the WHO experts in sperm, he was here lecturing last year, and he was saying sperm counts in men have fallen 50% in the last 50 years. And it's not slowing down, it's getting faster.
That's a lot.
Huge, yes. So that's, and it's the environment. The planet we live on is not healthy. The food we eat is not nearly as healthy as it was 20 or 30 years ago. Think about fast foods, industrial fats, soft drinks with all the chemicals, vaping, smoking, alcohol. No alcohol is a safe amount to be taking, particularly when you want a baby. And just the general life we live, the air pollution affects sperm quality. So lifestyle and having a healthy weight, eating properly, making those choices can really help your fertility. But then there's a lot of guys that are really healthy. I would say 80% of the people I'm seeing in clinic, the guys are really healthy. They've been trying really hard, and there are genetic backgrounds to male infertility. And if you ask the sperm experts, they say 80 to 90% of male problems are actually genetic.
Oh,
and
wow.
we're just beginning to find out where some of those genes lie. We don't have, there are hundreds of genes that control sperm production in a man's body, and we know maybe 100 of them now.
So we can test for that as well?
There are some commercial tests. There are not very many available yet. We're bringing out a new one sometime this year. You can look for the ones we've known about for some time, the azoospermic factors, which tend to make men have no sperm, and you can find that in some men genetically when you do a karyotype and you look at the special little bit on the Y chromosome. But the newer genetics, commercially, those tests have not been available, but we're beginning to get near to those being available soon.
So I was about to ask you, what is azoospermia? So you just explained it. Basically, it's zero sperm production in the semen. And you said mainly genetic factors can be the major cause for that.
We think so. So if a guy is ejaculating and there is no sperm in that ejaculate, that's called azoospermia. And you do 2 sperm tests at least 6 weeks apart to make sure that it's a real thing and it wasn't just that you had dengue or influenza or just a one-off really bad sperm test. And also you need to do it in a proper sperm lab that's accredited for doing it. We see a lot of people doing that test in basic labs in Trinidad, and when they come to us, we can find a few thousand sperm easily. So you need to do it in a proper lab. So it's either a blockage and you're making sperm in the testicle and it's just not getting out, or it's not a blockage, it's a production problem in the testicle. And sometimes that's a genetic thing where you're not making the right hormones, and we can give some medication, but that's rare. Giving medication usually doesn't work for all the other causes, and actually it's one of the biggest problems in Trinidad and Tobago. Let's add in here, the biggest problem we face in the clinic is men who have been made azoospermic by an unhelpful doctor or an unhelpful pharmacist who's given them testosterone. And that happens all the time, and it shouldn't be happening. We've known for 30 years now, testosterone, proviron, androgens, anything that's a testosterone booster,
so
anabolic steroids, they all cause you to stop or reduce your sperm production. They shouldn't be used for fertility.
So that's the thing, because especially now, this is carnival season, you know, a lot of couples and males, females, everyone is using or would go to the gym and use these supplements and use steroids to boost themselves. So we have to just warn that using too much and using the wrong ones can actually contribute, as you say, whereas it will be muscle building, it's actually contributing to reduced sperm quality and quantity.
We should add in there that it's very healthy to be going to the gym, to be trying to build muscle, and to be taking protein supplements, and to be eating a high protein diet. That does not affect your fertility, and sports do not affect your fertility. It's rare for us to see men on anabolic steroids taking testosterone, but it is more common here. A lot of people don't have the understanding that if the doctor's giving you testosterone to make you big and bulky, it will make your testicles stop working and sperm production will go down. I think what people don't know is some of the protein powders are tainted with androgens. There was a study in the US that showed about 5 to 10% of protein powders used in gyms it's not on the label, but it does have a bit of testosterone in it. It's tainted with it. So I would just say to people, be careful. The best way to get protein into your body as a non-athlete, me telling you as a doctor, is to eat a lot of chicken or egg or protein, to have protein in your diet, not commercially manufactured protein powders. But
and for the vegetarians, paneer and tofu and chickpeas and beans and legumes. Yeah, so we have a wide range that we can consume naturally as well. You know?
Yeah, and those diets give you a longer life expectancy. If you eat a healthy diet with a lot of those proteins in them, you tend to live 10 years longer than other people. So it changes your life expectancy as well.
Wow, that's excellent. That's really good to know. You know, so we've been talking about the contributing factors, male and female. What are the different types of fertility treatments that are available locally for couples?
So when we are thinking about the treatments, we really do a deep dive into both the man and the woman and figure out what the problems are. And a lot of the time, it can be simple things like changing the guy's diet, reducing alcohol, cutting out smoking. Sometimes it can be something simple like for the woman, finding a thyroid imbalance and treating that. A thyroid being underactive is quite common. So there are some simple things. Losing weight for both couples sometimes is all you need to get pregnancies. So you don't always have to have something high-powered, expensive, and invasive, which I think people are scared about. So there's a lot we do in helping people help themselves.
Sure, no problem. And I mean, so that's the basic. So as we said, lifestyle, dietary changes, and then you have different levels of the fertility options that are available. So of course, even before we get to the, as you said, the high-powered part of it, there's basic things like the ovulation induction versus the artificial insemination, or IUI. So could you explain a little bit for our viewers and listeners what the difference would be and when they may have to initiate those types of treatment?
So for women that are older, say 42 plus, we often go to using egg growing medication. We call it ovulation induction to boost egg production every month. If you have PCOS or any reason that you're not ovulating and letting those eggs come out, we use egg growing medication for that as well, and we have injections. So egg growing is done for some people as a one-off. Other times it's used in conjunction with something like an insemination procedure. So often we'll suggest to a couple that we grow eggs for the woman, and we're going to clean up, filter that sperm and put it inside the womb. That's an IUI, intrauterine insemination. People call it artificial insemination. It's a simple-ish treatment that helps the sperm and eggs get nearer to each other inside the woman's body. Sometimes we're going to talk about doing something inside the womb with keyhole surgery to try and improve the lining. You can do that sometimes. And then sometimes we need to go to IVF. We go to IVF if the tubes are both blocked. You bypass the tubes with IVF, that's what it was designed for. Or if the guys have low sperm numbers, below about 10 million sperm, IUI doesn't work very well at all, and then you need to take a sperm and inject it into the egg with IVF and sperm injection. So lots of different options, and then you can genetically test embryos with IVF now. Lots of different things you can do.
Wow. And I mean, all of these treatments are available locally and through, of course, the TT-IVF Fertility Center.
Absolutely, and we have, as you were saying, a brand new facility. We've invested in one of the most beautiful IVF clinics in the Caribbean, but the IVF lab itself is really amazing quality now. We've got huge new air filtration systems giving us the purest air, and it means that we have an extremely good quality, internationally accredited service right here at home, equal to what you would get in London, Miami, New York, Toronto.
And do we also offer egg freezing, as you said, or sperm freezing as well, and embryo freezing?
We do all of that. We have a big cryo storage facility. We've been doing egg freezing for years. We do social egg freezing for women who want to hold on to their fertility. We do fertility preservation for cancer patients, sperm, eggs, embryos. Yes, we have everything that an international clinic would have available. Everything is right here in TNT at Trinidad IVF, yes.
Great. Would you say that the cost factor may be a limiting factor in all of this, though?
I think access is a big problem, and we're not having enough people here that are able to get the treatments they want or do those treatments. And it's two things. One, it's the cost, but it's also lack of awareness. And people, if they do come through, coming through incredibly late when success rates are low, but also not knowing that we have things available here. And then cost, yes, we're very transparent about cost. We break it down for you. And that's another factor that's an important one for people. They need to know. And actually, that's why we give a free nurse consult when people first come to the clinic. It's what frightens people the most, I think. And they need a free consult with a really expert nurse who can give them a bit of an idea of what they're getting into. And that really helps a lot.
Sure. Can a woman or can a couple conceive naturally after the age of 40?
Yes, they can, and we've all seen it happen. But it gets more difficult. I mean, let's explain why. When you're in your 20s, if I was 22, 1 in every 2 to 3 eggs would make a baby. That means I'd be likely to get pregnant if everything's working well with me and my partner every 2 or 3 months. At 40, you get 1 in every 12 eggs is good. So that's 1 good egg you get a year, 1, and it lasts for 12 hours. So you get 12 hours of fertility potential a year. And then once you're 45, it's 1 in 1,000 eggs are good. So women are biologically infertile naturally when they hit about 42, 43, 41, 42, 43. That's when you just naturally see the women that have had 15, 16 kids throughout their reproductive life, they tend to stop having pregnancies in their early 40s. There are things we can do to help. We do IVF, but there is nothing that will change egg quality. There's nothing, despite what you get sold on the internet, that will change the quality of eggs. And that's a fact in a woman's body.
Right. I mean, all of this that we are discussing, of course, we do know that this can have an emotional and a mental impact on couples as well. So, I mean, what do we do in order to assist them? I mean, I'm sure there's counseling services available, or, through the IVF clinic, and then, even coming through to us, it's important for us to also reassure them that this is not, again, a personal failure. It is medical aspects. Because then, even when we do some tests, there is a condition known as unexplained infertility. So sometimes we can do all the tests, but we really can't home in on a particular cause, but still, they haven't been able to achieve a pregnancy. And even with that, we need to let them know that there's still hope, because even fertility treatments can establish and ensure that they do conceive.
Yes, and I think unexplained infertility, people think it's their fault. What unexplained infertility means is that we don't have the tests yet to figure out what it is that's holding you back. But if you've been trying more than a year, there's something somewhere. And a lot of couples come through 10 years trying and they've been told it's unexplained. That's over 100 eggs that have gone past in her body that haven't got a pregnancy. So there's something obviously somewhere and we just don't have the test yet. So it's a failure of medicine. To help everybody know exactly why, but there are treatments for infertility that's unexplained as well. There's options. So I think the mental load of dealing with infertility is a hard one. We see that day in, day out. My view is I like to listen to people, to hear what they've been through, to see where they are in their journey, because everybody's at a different place. Some people are really dealing with depression, anxiety, relationship problems. People think are common. Actually, we see a lot of strength in relationships when you've dealt with infertility, a lot of strength in women who've been through a lot. Couples tend to not break up from infertility per se, but we have counselors too, fantastic counselors in the clinic that we provide free of charge, because it's so important to deal with your anxiety, your stress, your fear, your stigma. A lot of people come in feeling ashamed. They feel that they're the only one and it's hard to even come through the door. So there's a lot to deal with infertility.
Yeah. And when we have to, that's why we have to emphasize, and that's what we're trying to do as well, to get couples to realize that the earlier they come through, so do not wait for too long. If there are issues that are cropping up, then you do not wait for, like, as you said, 5-10 years to elapse, and then you're trying to start from scratch, because by then it may be too late. But what about the use of birth control or contraceptives? Does that contribute to infertility?
Absolutely not. Let me say that. In anything you're using for contraception is your way of controlling when you want to have a child. It's your way of family planning. And they've all been designed and they've all been proven to be very safe. They don't damage your fertility. And in fact, we use the birth control pill an awful lot in fertility clinics for certain conditions and sometimes to help people get into cycles. So absolutely, that's a myth. No infertility after the birth control pill. And all other forms of contraception are safe as well. And it's important that you choose to have the children you want when you want to have them.
That's very, very important. So what about herbal treatment? So, in our climate, a lot of people speak about these herbal treatments and they use it for uterine fibroids. What would you recommend?
So I am not a herbalist. But if you choosing complementary treatments alongside traditional medicine, I would say go to someone who's qualified. Unqualified people who sell bottles of brown liquid who have no qualifications, I would be extremely careful spending your money, a lot of money on those types of things, because I've never seen them work. So herbal medicines, fibroid teas, tisane, all of these different things, I've never seen them ever work. I have seen people spend thousands of dollars and come back 4 years later, particularly men with sperm problems that had hardly any sperm, and then they come back and things have got worse and there's no sperm now that we can work with. So I would say be very careful spending your time and money on things that have been shown time and time and time again not to help fertility. But I'm a traditional medical doctor. I'm also someone who believes in complementary alternatives. Personally, I go for massage and acupuncture when I have pain in my hip. I wouldn't choose it if I needed a fertility problem, and acupuncture has been very disappointing for fertility. It's not been shown in studies where you've got sham and real acupuncture to change anything. So I think be careful how you choose to spend the time that you have. Dr. Almoner, you're quite right. There is very little time that you have to play with fertility, and people come through 4 or 5 years too late to the clinic. And then the truth is your success rates are 10, 20, 30% less. Or if you've moved from 40 to 45 in that age time as a woman, your success rate has gone from a 50% chance of getting a baby to a 1 in 1,000 chance of getting a baby with your own eggs. That's the reality of the choices some people make without realizing the impact that time makes.
But even having said that, we still have the option of donor sperm or donor eggs. I mean, it is available, but then again, it's not the genetic, it depends on culturally and how we look at it from a religious aspect as well. So not everyone might be amenable to the use of that. So we don't want to get to that point necessarily. But I mean, we were just highlighting that these are options that are viable and available as well locally.
Yeah, absolutely. There are always options. And there is donor eggs, donor sperm, donor embryos, but they're not going to be right for all couples. That's the truth. And if you want to really improve your odds, the main thing is to come through quickly, not to spend years going round and round in circles. Yeah.
Very true. So some of the take-home messages we have for you all would be that infertility, again, is a medical problem. It's not moral. It's not a physical failure. Both partners need evaluation. Age matters, especially in women. And early assessment improves outcome. There are treatments available from ovulation induction straight through to infertility treatments. I would like you to give us a quick summary of, what our discussion today, what you think are the most salient, important messages for couples out there, especially post-carnival. We're not going to indulge in too much alcohol drinking, so we want to emphasize that as well. Be very moderate. Don't consume too much, because we want to see you after carnival to be able to manage you.
Yeah, so be safe on the road if you're playing mass. If you're not playing, be safe on the roads, be safe at home. So I think the important messages from today, Dr. Almoner actually summarized it beautifully because she knows this area too, is number one, you're not alone. Please don't think if you're dealing with fertility that it's unusual or you're the only one. It's 1 in 6 couples worldwide, probably 1 in 5 couples right here in TNT. That means that all of us know someone who is dealing with infertility right now. All of us. Really important. Number 2, time is really of the essence. Just like Dr. Almoner said, the time goes by and your success rate goes down, and your egg level starts falling from a woman's age of 32. So that's real. That's not made up to try and get people through to clinics to make money. That's the reality of human biology. There's a ticking clock for men as well. There's an issue on the men's side, but not quite as extreme as for women. And I think the third thing is don't be ashamed. The stigma and the fear that comes with infertility stops a lot of people from asking for help, both men and women. And the clinic is extremely professional. We've got people that know exactly what you're going through and will give you that support and care that you need. It's highly confidential. So, and if you need more, we have trained counselors as well who we integrate into care every step of the way. So you have a very highly specialized clinic right here in TNT, and we can help you overcome fertility issues.
Thank you very, very much, Dr. Catherine. This has been very enlightening. I think we have initiated a conversation that I would love for our community, everyone to hear and listen to. It's been an absolute pleasure to have you. I'm looking forward to having you back again, where we could now delve into the the ins and outs and the specifics on how do we come through the infertility clinic, what are the different procedures, what are the options available, you know, and even getting into the different investigations that may be afforded for couples. So as we close off, I would like to take this opportunity to wish the Muslim community Ramadan Mubarak, as it is going to commence later on this week, inshallah. Also, for those who are playing Mass today and tomorrow, please continue to be safe. You know, we would like to prevent any unwanted pregnancies, unwanted sexually transmitted infections. Stay safe out there. And, you know, we would like to ensure that everyone, you know, has a good time as well. But as our Prime Minister said also, to be very respectful, you know, of yourselves. Thank you very much to our IBN crew for your continued dedication and commitment to service. And we look forward to seeing you for our next program, inshallah, which will be in April. And we will be focusing on obstetrics. So we've bypassed the fertility issues and we are pregnant. So let's discuss that as well too. Take care, assalamu alaikum, and a very pleasant good evening to all.